Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we'll hand it over to you now to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. As many of you know, today is the day that the federal government's public health emergency regarding COVID-19 expires. Now, of course, this does not mean that COVID-19 is over or no longer a public health concern. While thankfully, case numbers, hospitalizations, and deaths have been declining since the start of the year, and now we're at some of our lowest levels since the pandemic began. The reality is that people are still getting sick, and tragically, the lives of 40 to 50 Ohioans are still claimed by this virus every week. Nevertheless, the end of the public health emergency is another step along the path that we've been taking for some time now, a transition from dealing with COVID-19 as a pandemic to coping with it as more of an endemic disease. Now, as background, then Secretary of Health and Human Services, Alex Azar, first declared a public health emergency at the end of January 2020. Former President Trump declared it a national emergency in March 2020. The declarations gave the federal government flexibility to waive or modify certain rules in the Medicare and Medicaid programs, as well as in private health insurance. The main goal was to help people get access to care. Now, since taking office in January of 2021, President Biden extended the emergency status several times, but now, after more than 3 years, it is expiring. Now, before I discuss it a bit more in detail and explain what the end of the public health emergency means, I want to emphasize that overall, I do not foresee any immediate or dramatic changes in the Ohio Department of Health's ability to serve as a resource as a result of this shift. We remain dedicated to preventing severe illness and death from COVID-19, particularly for populations at higher risk. And of course, we'll continue working to reduce the negative impacts of COVID-19. Now, in a broad sense, the transition that is starting today signals that COVID-19 testing, vaccines, and treatments will eventually return to a more traditional healthcare coverage model. As a result, while many Americans may continue to have little to no out-of-pocket expenses for COVID-19 care, over time, others, especially those who are underinsured or uninsured, may face some additional expenses. Now, let me briefly go over some of the changes you may experience regarding several aspects of COVID-19 care. Probably the most immediate change people will notice is that free COVID tests shipped to them from the federal government will no longer be available. Also, some insurance companies may not cover over-the-counter tests. In addition, coverage for tests performed by your provider or at a pharmacy may also have some cost depending on your particular insurance coverage. The good news here in Ohio is that the Ohio Department of Health has maintained a sizable supply of free COVID tests that we will continue to deploy to our local health departments, our schools, long-term care facilities, and other community partners on request. Also, those on Medicaid can continue to get free tests at home or elsewhere through September of 2024. Now, in terms of vaccines, the Centers for Disease Control and Prevention has indicated that the end of the public health emergency will not have a near-term impact on the availability of vaccine. As with tests, I can assure you that the Ohio Department of Health has a sizable supply of vaccine that we can distribute to areas of the state that may need it. For now, vaccines will remain free for all. Providers of federally purchased vaccines are, in fact, not allowed to charge patients for it, regardless of a person's insurance status. Even after the federal supply is diminished, many Americans will continue to pay nothing out of pocket for vaccines. COVID-19 vaccines, like other vaccines that have been recommended by the CDC, are a preventive health service for most private insurance plans. Currently, COVID-19 vaccinations are covered under Medicare Part B without cost sharing, and it's our understanding that this will continue. Medicaid will continue to cover all COVID-19 vaccinations without a copay or cost sharing through September of 2024. And Medicaid will cover CDC recommended vaccines for most beneficiaries thereafter. In addition, the federal government recently announced a bridge program to ensure that vaccines for the uninsured will remain free through 2024 at pharmacies, local health departments, and federally qualified health centers. Now, turning to treatments, it appears that out-of-cost expenses for certain COVID-19 treatments may change, depending on an individual's healthcare coverage, similar to costs that one might experience for other drugs through traditional coverage. Medicaid programs will, however, continue to cover COVID-19 treatments without cost through the September 2024 date. After that, coverage and cost sharing issues may vary by state. The Ohio Department of Health also has a supply of COVID-19 therapeutic treatments on hand to help mitigate future changes in coverage and so afford access for those who need it. There will be some other impacts of this change. The federal government instituted a number of telehealth flexibilities during the pandemic, and fortunately, the majority of those for Medicare and Medicaid recipients do not appear to be affected. One change that will be immediately apparent, however, is that the CDC will no longer compile its community transmission levels, which has been a benchmark many people and institutions have looked to when determining what safety precautions to take. The discontinuation of this dashboard is a result of the government's data reporting requirements expiring. Hospitals, for example, will now report fewer types of data, and they'll do so less often. Because of these changes, Ohio's coronavirus dashboard likewise will undergo some consolidation in the coming weeks. Rest assured, though, that we will continue to track levels of COVID cases and hospitalizations here in Ohio, but that national change to some of the data reporting requirements will necessitate the archiving of some of our dashboards. It's important to recognize, however, that many details regarding the impact of this public health emergency ending are really still unknown. But rest assured that throughout this transition, the Ohio Department of Health will continue to monitor the impact here in Ohio and will work with our partners to develop strategies to protect the health of Ohioans. Now, it's important to underline that the end of the public health emergency does nothing to change the message about the importance of staying up to date on your COVID-19 vaccines. If anything, it reminds us that getting vaccinated has played a big part in hopefully getting COVID-19 under control and allowing us to return to more normalcy. If you are over the age of 60 or have a serious chronic medical illness or are immunocompromised, staying up to date with vaccines is especially important. We're looking forward to the CDC coming out with new guidance plans for the fall and even the potential for new vaccines. But for now, if you have not received a bivalent vaccine dose, please get one. And if you are over the age of 60 or at increased risk related to a medical condition, please consider a second bivalent booster shot. In addition to the COVID-19 vaccine, the pandemic has certainly served to underline the importance of protecting yourself against all manners of preventable conditions. The measles outbreak last fall in Ohio is one prime example of what can happen when a vaccine-preventable illness enters a largely unvaccinated population. In Ohio, we're encouraged that the vaccination rates among incoming kindergartners improved in the most recent school year, but we still have work to do in order to ensure that all of our children are protected against so many preventable childhood diseases. And recently, the medical community got some encouraging news with the FDA's approval of a first ever vaccine for respiratory syncytial virus, or RSV, which, as you may recall, hit Ohio very hard this past year. The recently approved vaccine is for older adults, but we are also anticipating FDA approval later this year of a vaccine that would protect infants, who are the group most at risk for serious disease related to RSV. Now I want to take a break and turn to our guest, Dr. David Margolius, Director of the Cleveland Department of Public Health, further discuss some of the implications of the end of the COVID-19 public health emergency. Dr. Margolius, we know that the COVID-19 virus is not gone, and there's always the possibility, of course, of another surge, small or large. With the end of the public health emergency, as a local public health leader, what are you recommending people do now regarding testing and preparing themselves to be tested if they think they might have COVID-19?
Thank you. Thanks, Dr. Vanderhoff, for inviting me today from Cleveland. Really happy to be here. I'll answer that in two ways. So on the macro level, on the public health level, we have something now that we did not have back in 2019, and that is wastewater surveillance. Thanks to the Ohio Department of Health and federal surveillance, we will know when the next surge is coming, if it does come, in a way that we didn't have when this started. We were relying on individuals for testing. Now, for an individual who has upper respiratory symptoms of a virus that could be COVID, I would say, number one, you are contagious, and if you live with folks or work with folks who are vulnerable, act as if you are contagious by keeping your distance and staying home if you can. If you are looking for a test because you think it will determine whether or not you need treatment, local healthcare providers, local pharmacies, health department, a number of us have the ability to be part of these test to treat programs so that we can offer that, and that won't go away.
Thank you. On that same note, how does your team plan to support your community in terms of providing vaccinations and boosters over the coming months?
Great. Well, thank you. Yeah, and just as you said, there remains a large stockpile of federal vaccines free to everybody. Our focus in Cleveland remains on the first dose for COVID vaccination. We know that there are still folks out there who haven't gotten any doses of the vaccine. And we also know that people are making that decision every week. Maybe 100, 200 people in our county are making that decision to get their first dose. So we haven't given up on that. And we continue to do outreach advertisements, and we have vaccines available to help people make that decision.
Thanks. Yeah, looking back now at what we've done in Ohio around COVID, and particularly in the communities that you serve, what stands out for you as a bright spot in terms of accomplishments? What can you say about the public health system's coordinated efforts in your part of the state?
Well, I will say, and at the time I was a primary care doctor at Metro Health, helping to lead our COVID response. So I will say that things that didn't seem possible, we proved were possible. We stood up a 24/7 COVID hotline in 2 days. We said we were going to start it Friday, March 13th. We made that decision Wednesday, March 11th, 2020. So we know that with the right collaboration, urgency, leadership, that anything is possible. And I hope that we'll be able to take that energy, that collaboration to all of the different things that are affecting the public health of Clevelanders in the state of Ohio. Smoking, fentanyl, lead poisoning, traffic fatalities, Black infant mortality. We know we can do this, and recognizing that health is more than just the absence of COVID is a really important next step for our public health community and for you at home as well.
Thank you. Thank you very much, Dr. Magolius. Well, though, as I've said, COVID-19 is certainly not over, and there remains quite a bit of work to be done as we shift from an emergency footing. I'm encouraged by two national assessments of our efforts to date here in Ohio. One is that for the second year in a row, the Trust for America's Health, a national nonprofit organization, ranked Ohio in the top tier for its public health emergency preparedness. This ranking measures important aspects of readiness, such as disease surveillance, healthcare access and quality, and public health funding. The other was a study recently published in The Lancet, a highly regarded medical journal. That study confirmed that on a risk-adjusted basis, Ohio had one of the lowest per capita COVID-19 death rates in the United States. We ranked 8th out of 50 states in the District of Columbia. That ranking is particularly gratifying, as it's an indicator of success in the most important metric to all of us involved in public health, saving lives. It's a validation of the efforts of so many Ohioans, especially those who rolled up their sleeves and got a shot. So with that, we'll conclude and turn to questions. Ken, I think we can now take any questions there may be.
Okay, thank you, Dr. Vanderhoff. A reminder again to please limit yourself to one question. And our first question today is from Tara Morgan with WEWS.
Hi, good morning. Thank you. This question is for Dr. Vanderhoff. People in East Palestine have come forward with urine tests showing vinyl chloride metabolite in their systems months after the derailment. As the state's top doctor, what would you tell people about what these tests results mean and whether they should be spending hundreds of dollars on the tests?
Yeah, thank you for that question. It's a very good one. And we are very sensitive here at the Department of Health to residents' concerns about potential exposure to vinyl chloride. First, I think it's very important to restate that all of the monitoring of the air, soil, public and private water systems in the East Palestine area continue to show no concerning levels of contaminants. That monitoring continues to be widely accessible, and Governor DeWine's East Palestine briefings on his website have been providing constant updates on these monitoring efforts and results. Now, in terms of the testing for vinyl chloride, we understand and respect people's concerns, their desire for as much information as possible. But as we've been saying since the early days after the derailment incident, there really are no good scientifically based tests for quantitatively assessing past exposure. The urine tests that some have been getting do not, in fact, record the presence of vinyl chloride, but rather thiodiglycolic acid, which is a breakdown product of vinyl chloride, but also of other substances. So this test is non-specific. It does not reliably indicate specific exposure to vinyl chloride. So even if you have a relatively high test result of thiodiglycolic acid, it could be from a variety of sources. And that's because this is a substance which is commonly found in the urine samples of populations who have never been exposed to vinyl chloride. There are, in fact, several other sources of thiodiglycolic acid in urine. Now, and they include some very common things. For example, foods like raw onions, meat, poultry, seafood. some medications, including Zyrtec, and some vitamins, alcoholic beverages, cigarette smoking, some household products, including some paints and varnishes, and some chemicals that are used in the workplace. The chemicals that people may have breathed during the fire emergency are typically broken down and eliminated by your body in a matter of hours. So as we've been saying all along, what we encourage is that people who have these health concerns consult with their provider who knows their medical history and can help guide each individual patient in making the best decisions, including appropriate specialty consultation. And if you don't have a provider, the East Liverpool City Hospital, East Palestine Clinic is now open and fully equipped and ready to handle these questions on an individual basis and help provide people with ongoing care.
Okay, our next question is from Joe Ingalls, Ohio Public Radio and TV.
Morning.
Joe, you're muted. You have a question? All right, we can go back to you if you. No, go ahead. Go ahead.
Morning.
You know what? We won't skip you, Joe. We'll just put you back in line. Let's go to Laura Hancock from the Plain Dealer.
Yes, Dr. Vanderhoff, the Ohio disease reporting system, it's like 2 decades old, and it was hard to get a lot of specific information off of it. And it was searchable. A lot of times the reporters were trying to figure out certain things about, areas of the state and what was going on. And we were told that it wasn't searchable. You couldn't query it. I mean, have you guys started to make any of the updates that are necessary, or have you started to rebuild it? And is COVID still like a reportable disease for doctors and health departments?
Yeah, thanks for that question. Yeah, as we have gone through the last few years, there has been great emphasis within the department on updating and modernizing our data systems. As I think it's true not just for the Department of Health, but for so many companies, organizations, and healthcare providers. The process of updating these data systems is pretty extensive and takes quite a bit of effort. Nevertheless, an awful lot of the data that we collect and now post has in fact been updated to newer systems and is often available directly on our website when it may not have been at the beginning of the pandemic. Is everything done with that? Certainly not. And we continue an aggressive effort related to data modernization. And I believe that many of our local health partners have also experienced some of that impact, as I'm sure, I hope, have members of the public and the press. Dr. Margolius, to some extent, you're both a contributor and a consumer of our data systems. Do you have anything that you might be able to add there?
Well, I'll add that I know that your team has been working so hard on modernizing the data systems, and we're excited to see what comes next. And I'll just say, from City of Cleveland, where I'm signing paper timesheets, we are also trying to modernize our systems here, and it's hard, but we are going to do it. So I'm optimistic.
Is COVID still reportable?
All right, folks.
Oh yeah, and actually, I can slide that. Yeah, so in terms of COVID-19 reporting, COVID-19 is still a reportable disease, although with the changes that have occurred on a national basis here in Ohio, as I believe is true across much of the rest of the country, the timetable for the reporting has been liberalized a bit. At the very start, the requirements for a broad range of providers to submit that data within a 24-hour period, that has opened up a bit more. But yes, we are still gathering that information and getting those reports from medical providers and health departments.
Okay, we're going to try to go back to Joe Ingles now from Ohio Public Radio and TV.
And I'm sorry about that, folks. It's my fault, technical issues. So my question is that, people during this pandemic, COVID, they've really been more cautious about going to work sick, about testing if they feel like they might have symptoms, not spreading it around. But now, when there's not going to be all the avenues for these, are you afraid that we are going to see a lot more people going to work sick, not knowing they have COVID, spreading it to everyone, and eventually populations of people who that poses a great danger for will get it? Are you concerned about that?
Yeah, thank you for that question, because that's a very, very important message and one that we really want to convey to the public. COVID-19 is still with us. And unlike so far this year, flu and RSV, which have trailed off to essentially nothing in terms of our measurements, we're still seeing not only cases of COVID-19, but we are still seeing hospitalizations. And sadly, as I noted at the beginning, we're continuing to see deaths. 40 to 50 people every week, sadly, are dying from COVID-19. So we need collectively to maintain vigilance and to be caring about our friends, neighbors, family. We need, when we don't feel well, to take that very seriously and stay away from other people. We need to give consideration to whether or not we need to get a test, either because we may be eligible for treatment, or we may live or work around people who are particularly eligible or particularly vulnerable to this illness. The other important consideration, of course, that we've mentioned is that we still have people in Ohio who are at great risk for COVID-19. That's especially people over the age of 60 and those with certain underlying health conditions who may need a vaccine or may need a booster. And I just don't want people to misinterpret the end of the public health emergency with meaning that it is the end of COVID-19 as a public health threat. Dr. Margolius, again, you're also a physician working in public health. Anything you'd add to that?
No, thank you. Just to say that one of the benefits, as you mentioned, Joe, is that people were paying more attention to their community when they were sick themselves or contagious, and so we hope that workplaces continue to have paid sick leave or develop paid sick leave, robust paid sick leave if they don't already have it, because it could be COVID, it could be RSV, it could be the flu, and we want to make sure that people are able to take care of their coworkers if they have something that's contagious.
Okay, our next question is from Roosevelt Leftwich with Fox 8.
Yeah, Dr. Vanderhoff, just wanted to check with you guys about something here as far as the when the WHO made its announcement about ending their worldwide global emergency. One of the things that they talked about was that countries, even down to local levels, would not dismantle some of the apparatus that they set up in order to handle COVID. So if you could take a look from where the health department was the state health department was pre-COVID and where we are now, what is going to happen to some of the systems that were set up, not only just with the state health department, but also with some of the smaller counties that really had a lot of hard times dealing with this outbreak?
Yeah, thank you for that question. And I'll build on some of the comments I made in my opening statements. So much of what we have been doing related to not only COVID-19, but as the CDC has been encouraging, thinking more and more about a serious respiratory illness that includes COVID-19, the infrastructure that we have in place is not going away. Both the Ohio Department of Health and our local health partners are continuing to gather information, to post data and information. We're continuing to make testing available. We're continuing to make vaccines and therapeutics available. And while we don't know everything about exactly how the transition will play out of moving from a declared public health emergency into a new state of dealing with COVID-19, we are not dismantling our public health response capabilities or resources. We're simply evolving them as the nature of this pandemic is itself evolving. Dr. Margolius, at a local level, anything that you would add to that?
Yeah, we have robust support through Ohio Department of Health and the CDC Public Health Infrastructure Grant to be able to take care of health in its totality. And so we're in a really good place. We also, wastewater surveillance I mentioned didn't exist before COVID that we have now. And just the fact that we developed as a country a vaccine in 9 months that, took us from ICU full of people on ventilators with COVID to a much different situation where severe illness was seen as preventable thanks to that vaccine. So that is something that we know that we have going into future pandemics that we didn't know about before.
Our next question comes from Jim Provence with the Toledo Blade.
Hi, Dr. Vanderhoff. I'm going to build on something that we talked about a little bit earlier. From our experience over the last 3 years, what has Ohio learned that is better prepared it for the next pandemic that is not COVID related? I know wastewater monitoring may warn us of the next COVID surge, but is that going to tell us anything early about something that is not COVID?
Yeah, thank you so much for that. So I think we've learned a number of things, and our experience going through this once in a many generation worldwide pandemic really brought a lot of strengths and opportunities to light. One of the areas that we learned a lot about was the importance of being able to not only gather but post data. This again reflects the question of one of our earlier reporters. Gather and post data in ways that are highly accessible for people. Because as the governor has said repeatedly, the more transparent we can be with what we know, the better it is. The better people are able to understand and respond to what we're concerned with. So we've learned a lot there. Very proud of the work that has occurred over the course, especially over the last 2 years, related to the Innovate Ohio platform and getting a lot of that data posted in ways that are highly accessible. Again, as I noted, there's more work to be done, but we're continuing to press forward on that work. Another area of learning is the vital role of coordination across the state. And we now have frameworks and structures in place that we're going to work to maintain that allow us to be so much more nimble and responsive. I can't go through a laundry list, but I'll give you one great example, and that is our hospital zone system, where we now have the entire state organized into 3 major zones that are able to work with my office and the governor's office in a highly coordinated manner and address emerging issues very rapidly. So, whether it's a ventilator shortage or a problem with supplies that may be related to a national supply shortage, or something as straightforward as a given institution losing morgue capability because of just a systems failure and needing to be able to turn quickly, get that information to us, and for us to be able to deploy that resource. It's all the kind of response now that we can do within a matter of hours because of the increased coordination that we have. So I could go on and on, but I hope that gives you a flavor for what we're talking about. Again, Dr. Margolius, this I think is also
You got
putting it at the local level.
Yeah, you got it. Yeah, just refer to my earlier comments. We're in a very different place and ready to respond.
Okay, our final question today is from Danny Eldridge with Hannah News Service.
Hello, thanks for taking our questions. My question's about, so with the end of the pandemic, we're going through Medicaid redetermination right now. So thousands of people are going to lose their healthcare coverage. What kind of effect is that going to have on the state health department and local health departments? And will you see increased strain on these systems?
Well, thanks for that question. Yeah, I think it's something we're watching very, very closely. I can tell you that our stance is to be working to mitigate wherever we can the likelihood of there being an impact. So as I was going through, for example, I'm talking about COVID-19, we're working to provide as many bridges as we can to those who may be or underinsured to ensure that, for example, with COVID-19 care, those issues are addressed. But I think that a lot remains to be seen, both in terms of what those numbers actually end up being, and we'll have to continue to work together to identify opportunities to provide bridges for people who are impacted.
Hey, thank you again for joining us today. Dr. Vanderhoff, do you have any closing remarks?
Well, I want to thank everyone again. I know it's been a while since we've had an opportunity to get together and talk about public health issues in this forum. As always, I really appreciate not only your attention, but your important messaging, as well as the really good questions that you asked.
Okay, this concludes today's press conference.